Good day everyone. Today we'll be talking about the drugs acting in uterus. There are 50 questions given for this certain topic. Question number 1. These are agents that bring about increase in uterine contractions. A. Ecbolics, B. Tocolytics, C. Relaxin, D. Prostaglandin. So the correct answer is A. Ecbolics. A drug is an ergot alkaloid that tends to increase uterine contractions and that is used especially to facilitate delivery. Question number 2. These are agents that inhibit uterine contractions. A. Ecbolic, B. Tocolytic, C. Prostaglandin, D. Relaxin. So the correct answer is B. Tocolytic. Tocolytics help prevent and slows contractions of the uterus. It may help delay birth for several hours or days. Question number 3. These are agents used to relax uterine smooth muscle and may be used to delay labor and to stop threatened abortion. A. Ecbolic, B. Tocolytic, C. Relaxin, D. Prostaglandin. So the correct answer is B. Tocolytic. Drugs that prevent preterm labor and immature birth by suppressing uterine contractions. Question number 4. A hormone that plays a major physiological role in milk letdown and labor initiation. A. Oxytocin, B. Prostaglandin, C. Estradiol, D. Progesterone. So the correct answer is A. Oxytocin. The other hormone, oxytocin, causes the breast to push out or let down the milk. Question number 5. This is a hormone of the posterior pituitary received from the hypothalamus. A. Oxytocin, B. Prostaglandin, C. Relaxin, D. Carbachol. The correct answer is A. Oxytocin. Oxytocin is a peptide hormone and neuropeptide normally produced in the hypothalamus and released by the posterior pituitary. Question number 6. All are clinical uses of oxytocin except A. For milk letdown, only in agalatic animals. B. For treatment of uterine inertia and for rapid involution of uterus. C. To arrest postparturient hemorrhage. D. None of the above. So the correct answer is none of the above. Oxytocin is a hormone that is used to induce labor or strengthen uterine contractions or to control bleeding after childbirth. Question number 7. All of these drugs help in relaxing uterine smooth muscles except A. Salbutamol, B. Ritodrine, C. Atosiban, D. None of these. The correct answer is C. Atosiban. Atosiban is used as an intravenous medication as a labor repressant to hold premature labor. Question number 8. It has a physiological role in parturition, including softening, relaxation of cervix, and pelvic ligament and expansion of reproductive tract to ensure easy and safe parturition. A. Oxytocin, B. Relaxin, C. Tocolytic, D. None of this. The correct answer is B. Relaxin. In preparation for parturition, it relaxes the ligaments in the pelvis and softens and widens the cervix. Question number 9. An ergot alkaloid with vasoconstrictor effect and not usually used for induction of labor due to its strong action on uterus. A. Tocolytic, B. Ergonovin, C. Ergometrin, D. None of these. The correct answer is C. Ergometrin. The strong action of ergometrin in uterus may cause fetal asphyxia due to vasoconstriction. Question number 10. An alkaloid that also has a oxytocic action but lacks a vasoconstrictor action. A. Tocolytic, B. Ergonovin, C. Ergometrin, D. None of these. The correct answer is B. Ergonovin. The synthetic derivative of ergonovin, the methyl ergonovin, has a powerful ecbolic action but lacks vasoconstrictor action. Question number 11. Ergometrin is generally indicated for A. Termination of pregnancy at a very early stage, B. For expulsion of retained placenta, C. A and B is the correct answer, and D. None of the above. The correct answer is C. A and B is correct. Ergometrin is also used in the active management of the third stage of labor and in the treatment of postpartum hemorrhage. Question number 12. A peptide found in pituitary gland of many non-mammalian vertebrates. It has oxytocin and ADH actions. A. Arginine vasotocin. B. Carbachol. C. A and B is the answer. D. None of the above. The correct answer is A. Arginine vasotocin. Like vasopressin, serves as an important modulator of social behavior in addition to its peripheral functions related to osmoregulation, reproductive physiology, and stress hormone release. Question number 13. Oxytocin can be administered through A. Orally, B. IV or intramuscular, C. Parenteral, D. None of the above. The correct answer is B. IV or intramuscular. Oxytocin can be given intravenously or intramuscularly. When given orally, it is destroyed in the gastrointestinal tract. Question number 14. These are drugs which exert a stimulant action on uterine contractions, especially that of atonic or hypotonic parturient uterus. A. Oxytocics, B. Ecbolic, C. Tocolytics, D. None of the above. The correct answer is A. Oxytocics. Oxytocics are used to induce labor, obstetric at term to prevent or control postpartum or post-abortion hemorrhage, and to assess fetal status in high-risk pregnancies. Question number 15. Which of the following is the physiologic role of oxytocin? A. Induce labor, B. Milk ejection reflex, C. Neurotransmitter, D. All of these. The correct answer is D. All of these. Main physical functions of oxytocin are to stimulate uterine contraction and to stimulate contractions of breast tissue, to aid in lactation after parturition, and also act as a neurotransmitter in brain. Question number 16. Which drugs are used for cervical ripening? A. Dinoprostone, B. Misoprostol, C. Dufaston, D. Both A and B, E. Both A and C. The correct answer is D. A and B. Dinoprostone and misoprostol are prostaglandin analogs used in induction of labor, practiced for ripening of cervix and stimulating uterine contractions. Question number 17. What are the adverse effects of prostaglandin use? A. Nausea, B. Tachyphylaxis and drowsiness, C. Fever, chills, and vomiting, D. Sedation. The correct answer is C. Fever, chills, and vomiting. Prostaglandin's adverse effect: nausea and vomiting, chills, flushing, back pain, diarrhea, and abdominal pain. Question number 18. What is misoprostol? A. PGE2 analog, B. It can be administered intravenously, C. Synthetic preparation of PGE2, D. It can be administered orally and sublingually. The correct answer is D. It can be administered orally and sublingually. Misoprostol tablets have been given sublingually or buccally with better efficacy result than orally. Question number 19. Ergometrin is an A. Ergot alkaloid, B. Bolus injection, C. Water injection, D. Contraceptives. The correct answer is A. Ergot alkaloid. Ergometrin is an ergot alkaloid used for the treatment of postpartum hemorrhage and post-abortion hemorrhage in patients with uterine atony. Question number 20. Plays a key role in the reproductive health and function. A. Fertility, B. Uterus, C. Liver, D. Pancreas. The correct answer is B. Uterus. Uterus is an organ in the reproductive system that plays a critical role in the menstruation, fertility, and pregnancy. Question number 21. Which of the following does not belong to the group? A. Corpus, B. Fundus, C. Anus, D. Isthmus. The correct answer is C. Anus. Corpus, fundus, and isthmus is part of the female reproductive system, which is the uterus. Question number 22. Which of the following anti-hypertensive drug is or used for pregnant animal? A. Methyl-dopa, B. Hydralazine, C. Nifedipine, D. Both A and B, E. Both A and C. The correct answer is D. Both A and B. Methyl-dopa, hydralazine, labetalol, nifedipine B blockers, and hydrochlorothiazide are drugs for pregnancy. Question number 23. Generic name for Corlim: A. Mifepristone, B. Carboprost, C. Cromil, D. Methergine. The correct answer is A. Mifepristone. Generic name of Corlim mifepristone is a cortisol receptor blocker, antiprogestin. Question number 24. Blank is a ganglion blocking agent: A. Atropine sulfate, B. Pachycarpine hydroiodide, C. Carpine sulfite, D. B blockers. The correct answer is B. Pachycarpine hydroiodide. Pachycarpine is obtained from the aerial parts of Sophora pachycarpa, a ganglion blocking agent, which means uterine muscle stimulant. Question number 25. A parenteral drug that decreases uterus contractions when administered: A. Sodium sulfate, B. Magnesium sulfate, C. Magnesium tartrate, D. Sodium tartrate. The correct answer is B. Magnesium sulfate. Magnesium sulfate is used to prevent seizures in preeclampsia, a condition in which the pregnant develops high blood pressure and protein in the uterine. Question number 26. Drug agent that are designed to inhibit contraction of myotrial smooth muscle cells: A. Mucolytic, B. Sympathomimetic, C. Tocolytic, D. Muscle relaxant. The correct answer is C. Tocolytic. Tocolytic are drugs that used to delay delivery for a short time, up to 48 hours if starting in labor for too early pregnancy. Question number 27. A body that produces estrogen and progesterone, size of an almond, and each follicle contains one oocyte: A. Ovaries, B. Fallopian tube, C. Fundus, D. Perimetrium. The correct answer is A. Ovaries. Ovaries are small almond-shaped glands located on the either side of uterus and produces estrogen and progesterone. Question number 28. Contains uterine cavity which expands during pregnancy: A. Ovarian ligament, B. Corpus, C. Squamous epithelium, D. Connective tissue. The correct answer is B. Corpus. Corpus luteum's job is to make your uterus a healthy place for a fetus to grow. These glands expand during pregnancy stage. Question number 29. The narrow inferiormost region of the urethra is the blank: A. Cervix, B. Placenta, C. Fetus, D. Isthmus. The correct answer is A. Cervix. Cervix, the inferiormost region of the urethra that serve as a door to the female reproductive system and responsible for the menstrual cycle, pregnancy, and fertility. Question number 30. The blank constitutes most of the wall. It is composed mainly of bundles of smooth muscle that sweep downward from the fundus and spiral around the body of the uterus: A. Cervical glands, B. Endometrium, C. Myometrium, D. Polymetrium. The correct answer is C. Myometrium. Myometrium holds the structural integrity of the uterus and generates force for parturition with its primary component, the smooth muscle cells. Question number 31. Can lipophilic drugs cross placenta and enter fetal circulation? A. No, B. Yes, C. Maybe, D. Somehow. The correct answer is letter B, yes. Yes, because in general, small molecular weight and lipophilic drugs readily cross the placenta. Question number 32. The plasma half-life of oxytocin ranges from A. 1 to 6 minutes, B. 1 to 5 minutes, C. 1 to 8 minutes, D. 1 to 10 minutes. The correct answer is A. 1 to 6 minutes. Oxytocin has a plasma half-life of about 1 to 6 minutes, which is decreased in late pregnancy to prevent during lactation. Question number 33. A drug used to treat convulsions during pregnancy, nephritis, magnesium deficiency, and tetany. A. Ritodrine, B. Magnesium sulfate, C. Indomethacin, D. Nilidine. The correct answer is letter B, magnesium sulfate. Magnesium sulfate is used in pregnancy to prevent seizures due to worsening preeclampsia, given as intravenously infusion or intramuscular injection in the hospital for 12 to 48 hours. Question number 34. An adrenergic beta agonist used to treat premature labor. A. Ritodrine, B. Nifedipine, C. Phenytoterol, D. Salbutamol. The correct answer is A. Ritodrine. Ritodrine is used to stop premature labor. This medicine was available only with doctor's prescription. It works by reducing the contractions of the mucus in uterus. Question number 35. A non-steroidal anti-inflammatory used for symptomatic management of chronic musculoskeletal pain conditions and to induce closure of a hemodynamically significant patent ductus arteriosus. A or C. Prenaline, B. Isoniazid, C. Indomethacin, D. Premaquine. The correct answer is letter C, Indomethacin. Indomethacin is a non-steroidal anti-inflammatory drugs used to treat mild to moderate acute pain and musculoskeletal pain conditions. Question number 36, 37, and 38. Oxytocin is a blank hormone produced in the blank and secreted by the blank. A. Peptide, B. Posterior pituitary, C. Hypothalamus, D. Ovary, E. Mammary gland. The correct answer is oxytocin is a peptide hormone produced in the hypothalamus and secreted by the posterior pituitary gland. Question number 39. The goal of cervical ripening is to A. Increase rate of failed induction, B. Reduce value of failed induction, C. Reduce rate of failed induction, D. Increase value of failed induction. The correct answer is letter C, reduce rate of failed induction. The goal of cervical ripening is the reduction of failed induction. Question number 40. Which is or does not belong to the group of PGS adverse effect? A. Fever, B. Chills, C. Vomiting, D. Both A and C, E. None of these. The correct answer is letter E, none of these. The goal of cervical ripening is to reduce rate of failed induction. It is a normal process of softening and opening the cervix before labor starts. Question number 41. The following are the adverse effects of methylergonovine. A. Nausea and vomiting, B. Chest pains, C. Drowsiness, D. Both A and B, E. All of these. The correct answer is letter D, both A and B. Prostaglandin adverse effect include nausea, vomiting, chills, fever, back pain, diarrhea, and abdominal pain. Question number 42. A drug that used to cause cervical ripening and stimulate uterine contractions as well as to treat patients with postpartum hemorrhage. A. Misoprostol, B. Silostazol, C. Calvedilol, D. Metoprolol. The correct answer is letter A, misoprostol. Misoprostol causes cervical ripening before induction with oxytocin. It can be administered orally, sublingually, or vaginally. Question number 43. Is there one drug of choice of tocolytics? A. No, B. Yes, C. Maybe. The correct answer is letter A. The drug of choice of tocolytics are magnesium sulfate, indomethacin, and nifedipine. Question number 44. COX-2 is blank. A. In gestation tissues, B. Induced in myometrium during labor, C. Reduced in myometrium, D. Tocolytics. The correct answer is letter B, induced in myometrium during labor. COX-2 is induced in myometrium during labor, thus appear to be required for every step of early pregnancy, including ovulation, fertility, and implantation. Question number 45. First line tocolytic. A. Sodium sulfate, B. Magnesium sulfate, C. Calcium sulfate, D. Iron sulfate. The correct answer is letter B, magnesium sulfate. Magnesium sulfate has become the first-line tocolytic for short-term use to arrest idiopathic preterm labor. Question number 46. Route of magnesium sulfate. A. Intravenously, B. Intramuscularly, C. Intracutaneous, D. Subcutaneous. The correct answer is letter A, intravenously. The route of magnesium sulfate is intravenous for faster distribution. Question number 47. Magnesium sulfate therapeutic range. A. 4 to 7.5 or 5 to 8 mg per dl. B. 3 to 7.5 or 6 to 8 mg per dl. C. 2 to 7.2 or 5 to 7 mg per dl. D. 1 to 1.2 or 5 to 8 mg per dl. The correct answer is letter A, 4 to 7.5 or 5 to 8 mg per dl. The standard therapeutic of magnesium sulfate ranges from 4 to 7.5 or 5 to 8 mg per dl. Question number 48. Route of terbutaline. A. Subcutaneous and intramuscularly, B. Intramuscularly and intravenously, C. Subcutaneous and intravenously, D. Intravenously and intracutaneous. The correct answer is letter C, subcutaneous and intravenously. It was administered subcutaneously or intravenously to treat premature labor. Question number 49. Prevent or reduces the severity of neonatal respiratory distress syndrome by accelerating long maturing in fetuses between 24 to 34 weeks gestation. A. Indomethacin, B. Methyl-dopa, C. Bisoprolol, D. Betamethasone. The correct answer is letter D, betamethasone. Betamethasone can help speed up lung development. Question number 50. Bound the uterus to the anterior body wall. A. Round ligaments, B. Mesometrium, C. Cervicanal, D. Cervix. The correct answer is letter A, round ligaments. Round ligaments are rope-like band of corrective tissues that support the uterus.